Knowing the signs and symptoms of heart disease and a heart attack can help save a life. Heart attacks are serious medical conditions. Therefore, it is important to learn the signs and symptoms of a heart attack. In today's program, Dr. L Saravanan, Director, Institute of Cardiac Sciences, Bangalore Baptist Hospital, will discuss how to be heart healthy. This will be a focus session on lifestyle modification to reduce risk of heart disease. This session will principally focus on diet, exercise, stopping smoking. In addition, we will also be discussing benefits of regular health checkups to identify risk factors for heart disease such as high blood pressure and diabetes and treat them effectively to avoid complications such as heart attack and stroke. Please listen to this program called Healthyliving every Tuesday at 8 a.m. and 8 p.m. on FEBA Online. If you have any questions and for more information, please write to us at info@febaonline.org or you can call or WhatsApp us to 916364252164. Thank you, Doctor, for joining us in Healthy Living program. Thank you so much. So today we'll talk about various aspects of heart disease. So Doctor, please tell us about how a heart functions, the functioning of a heart.
Sure. Various organs in the body need blood flow, oxygen. For the organs to receive and function very well, they need oxygen. And for the organs to receive this oxygen, the heart has to pump the blood.
Okay.
So the heart acts as like an engine for a car.
Mm-hmm.
Okay, there is no car without the engine, so there is no human being without the heart.
Mm-hmm.
The heart is the main organ that pumps oxygenated blood to the body, and that is its main function. It's a mechanical pump and pumps this oxygen.
Mm-hmm.
The oxygenation happens in the lungs. Mm-hmm. So all the unoxygenated or the deoxygenated blood, the blood goes to the organs. The organs take the oxygen and the nutrition, and then the waste blood comes back to the heart and then gets pumped to the lungs for further oxygenation. And then from the lungs, it comes back to the heart to be pumped out. For this to happen, the heart has to have two compartments or two different circuits. If you know, when you're an electronics engineer, you will understand. There are two aspects. So the right side of the heart receives all the bad blood or the unoxygenated blood that comes back from the body, gets pumped to the lungs. The lungs then oxygenate it, and then the fresh blood comes to the left side of the heart and then gets pumped to the body.
Okay.
Therefore, the left side and the right side of the heart should not communicate because they're two different components completely.
Okay.
But they work as a whole.
Mm-hmm.
And they also have to work in a fashion where when something comes in, then it has to relax and then it has to contract. And when it is contracting, when the heart is pumping, it shouldn't be pumping back to the lungs. It should be pumping to the body. So this is all controlled by a good, very systematic, hierarchical electrical system.
Okay.
And there are valves inside the heart which prevents the backflow of blood.
Okay.
So when you look at the heart, there are three components: the muscle of the heart, which pumps, the wiring of the heart, which ensures that it happens in a very sequential fashion, and then the valves, which prevent backflow.
Okay.
So these constitute the heart.
Okay.
When one or other is not functioning properly, you end up getting heart disease.
Okay. So when you talk about heart disease, when you said heart disease, what is it? What are the dysfunctions?
Okay. The commonest heart disease, and particularly in India, the commonest heart problem is heart attack. Okay, and a heart attack is the commonest disease that kills a lot of people. Increasingly, I am very concerned that we are seeing this happening in younger people. When I was a trainee doctor in South India, we saw a heart attack happening over 40. Anyone below 40, if they came to see me or if they came to the hospital and they said chest pain, we wouldn't ignore it. We would say it can't be heart because you're too young to have a heart problem.
Yeah.
But now, the youngest person I have done a procedure in following a heart attack, the youngest person I have treated with a heart attack is an 18-year-old girl.
Okay.
So it is happening very, very frequently and also in much younger population. And this is the most common heart disease.
Okay.
The heart attack happens when blood flow to the heart. Even though the heart is the organ which pumps to the entire body, it needs blood for itself.
Yes.
for it to function. The way it does that is, as soon as the blood comes out of the heart, it comes back to the heart in 3 arteries called coronary arteries.
Okay.
These 3 arteries are on the surface of the heart. And these 3 arteries supply fresh blood to the heart for the heart to function. If any one of the artery gets blocked, you get a heart attack. So that is what a heart attack is.
Okay. When are those blocks formed?
The blocks are formed as a result of deposit of cholesterol into the lumen, into the artery's inner side surface. The arteries are tubes, basically. When the tubes get blocked, very much like your kitchen sink, if you keep putting more and more dirt into it, it slowly scale forms and it blocks off. Very similar to that. As we grow older, as we eat bad food, as we don't do exercise, if people smoke, number of risk factors which increases the risk of deposition of cholesterol into the lumen of the heart. And that makes the heart arteries become a little bit rigid and narrow. The lumen of the arteries become narrow. This is not an overnight process. This happens over several years slowly. As a result, patients or individuals who have these narrowings may not have a great deal of symptoms until the point when the narrowing becomes so critical that it almost blocks the artery. And once the artery gets occluded and the artery occlusion happens overnight, then they get a heart attack. So the early signs when the heart artery is narrowing, the early signs of narrowing of the heart arteries is usually a symptom called angina. Angina is a term we use in medical field, but that angina is something that everybody experiences in various forms. And the commonest symptom complex of that is chest pain. Pain in the chest. So any pain in the chest, above the hip area, below the neck, any pain in the chest, which comes on when somebody is doing some exercise. The commonest thing that I ask my patients is, when you run upstairs or when you walk briskly up the stairs, do you get any symptoms? They say, oh yeah, sometimes I feel heavy in my chest. That is worry. Okay, if you feel heavy in your chest when you're walking up the stairs or when you're lifting your supermarket, shopping and walking, and those times if you feel that way, the moment you stop, you feel more relaxed. That is very worrying. That is angina. People think that heart disease should give you very severe crushing pain and sharp. It's not like that. It is an uneasy feeling in the chest. So that is angina.
Many people have this assumption that if it is critical, that is when it is heart attack. But most of them does not follow the symptoms which they go through. Like for example, if they walk, sweat is one thing. They oversweat when they have some heart disease and BP, blood pressure. So how these things are related to?
Yeah, I mean, the symptoms are many times subtle. They are not always very critical or crucial. People tend to believe that heart disease should give you a very serious symptom. And a number of times when I tell my patients after tests that you will have, as the tests show that there is evidence that you have blocked artery, then they say, oh, no, it's only once in a while I get this. I don't think it is important. And then they are in the state of denial. Because first thing, obviously, none of us want a heart attack, so we are worried about it, so we don't want it. But more importantly, more worryingly, in the Indian population, we tend to ignore till late stages. For all illnesses, we tend to ignore our health until the symptoms become unbearable. The other common thing people do is adjust their life around symptoms. So if you start getting some discomfort when you're walking stairs, you take the lift. Okay. and so things like that. So you adjust your life to the symptom rather than address the symptom. Okay. So those are important, and therefore the focus should be that any symptom, if you have risk factors, and for that matter, I say every Indian is at risk, and therefore, if you have symptoms that is causing you concern, don't delay. Go and see a specialist, and we will be able to delineate whether the problem is gastric, or whether it is heart disease, or whether it is something else, whether it is a lung disease, or is it a simple muscle ache. Okay, there are a lot of times when we were talking earlier about this, that a lot of times when people have gastric problem come to me, and heart attack people don't come to me. Okay, And this is a common myth among people, thinking that all symptoms that come around this area is all pains coming around this area or back and front of the chest is due to gastric problems or so-called gas trouble, as they call it. The only thing that can cause symptoms similar to a heart attack is a condition called esophagitis or inflamed food pipe. If we have excess acid in the stomach and if that acid comes up the food pipe, and if the food pipe becomes very sore and red inside, which it can, very common problem, if that happens, then the food pipe will go into what's called a spasm. When the food pipe goes into spasm, it produces a pain. That pain is the same pain as a heart attack because the heart and the food pipe are supplied by the same nerve. So the brain cannot differentiate where the pain is coming from. So people will come to us thinking they have a heart attack, and then when we do all the tests, it will be normal. Then we give treatment for this inflamed sore gullet. So it is better to assume that that pain is heart attack, come and check out, rather than assume that is due to your gas trouble and not get checked out. Because it's very difficult even for a qualified professional like me to be able to differentiate between these two.
Heart attack. It's strange because you're a doctor, you know these are what the differences are. But a common man, as you said, most of the people doesn't want to admit that they are undergoing a heart attack. So what do you want to tell them?
Several things. First is don't ignore any symptoms. Number one, any symptom, check it out. And have a reliable, that's another big concern in India now, because how reliable is the health service that you're accessing is another thing that everybody's worried about. So have a reliable hospital source that you can access and go and see your clinician who you trust, your doctor who you trust. Explain the symptoms to the doctor, to the expert, and let them decide whether it is gastric or heart disease. That's number one. Number two, have a regular health checkup. And that is so essential for almost all Indians now. Earlier, I used to say over 40 every 5 years, get a checkup. Now I'm saying over 20 every 5 years, get a checkup. Over 40 every 2 years, get a checkup. And that is full body checkup, full everything checkup. And generally, checking for blood pressure, sugar, and cholesterol, you can get it done every year. Simple test.